February is American Heart Month, and to talk about ways we can all make ourselves more heart healthy, I'd like to welcome to the studio Lisa Rigsby, YMCA of Greater Charlotte, Director of Community Health. Thank you for joining us here in the studio.
Thank you for having me.
I think it's important that we talk a little bit about things that we can all do in our daily lives to improve our heart health, and one of them deals with nutrition. First and foremost, you say sodium is something we really have to watch in our diets.
Yeah. Continued intake of sodium is one way that your blood pressure will go up and stay up. And so trying to keep sodium at a low by mixing in different herbs and spices instead of using salt or salty spices, spice mixes is a really nice way to make sure that you're keeping sodium low.
Adding salt to our food to taste is one way that sodium is in our diet, but are there a lot of ways it's sort of hidden in things that we may be buying?
Absolutely. So we as Americans love our processed foods, and so trying to keep processed foods at a minimum, but also, you know, when you have canned beans or canned food in your cabinet, which is an awesome way to get your fiber, to get protein, to get just different vegetables in, there's some sodium that can be hidden in there. So you want to look for low sodium or no salt added when it comes to canned food. But if you do end up with ones that don't say that, the best thing to do is pour them in a colander and then rinse them until the water goes clear, and that'll cut the sodium by about 30 to 50%.
Wow, I have made a mental note when I go to the grocery store myself. I choose the ones that say no salt added.
Yeah.
Because you just don't realize it's sneaking into your food that way.
Absolutely.
Each person's health is different, but is there a target amount of sodium if you really wanted to be a stickler and start calculating how much you're taking in every day?
Sure. So it depends on who you look at. So if you're looking at the American Heart Association, which is an awesome reference, they're saying about 15 to 1800 milligrams a day. So if you keep that number in mind, it'll start to really help you make better decisions. The American Dietary Guidelines says it's a little bit higher at 22 to 2300 milligrams. So really trying to reduce it as much as you can to keep it within that range would be helpful.
And really checking the nutrition label in general is something that we should probably all pay attention to. I've even started to notice when you go to restaurants or you go to the store that they're more visible now. But what are the big items on that nutrition label we should watch?
Sure. So of course sodium. And then the nutrition label actually changed a couple of years ago, so you can tell the difference between naturally occurring sugar and added sugar. So trying to keep added sugar to a minimum also, because we know that that contributes to chronic disease, type 2 diabetes, and other heart disease, other chronic diseases. And then keeping your fiber and protein a little bit higher. So you want to look at what the ratio is with those. And then of course, don't ignore the ingredient list. You want to be able to pronounce everything on the ingredient list, and you want to keep sugar and salt kind of out of those as best as you can.
Great. You guys at the YMCA of Greater Charlotte are really mobilizing your effort to help people improve their health, and you've got something called the Wellness on Wheels unit, and here we see it.
Yes.
Tell me a little bit about it.
Great. So this is Wellness on Wheels, and it is in partnership with Atrium Health. So they it's been an awesome collaboration with them in order to, again, mobilize health, but also provide services and screenings in neighborhoods where there might be folks who have low or no insurance, low income, and just have a harder time accessing services. And so this unit rolls into the neighborhood, and we're there. We serve Tuesdays and Thursdays for a 3-hour window every time we're out. And when people go on the unit, they walk right through this orange door here, and they get their blood pressure screened, blood sugar, height and weight, and are able to have a conversation with their registered nurse about their risk factors. And so are you able to access food? Are you able to see a primary care physician? And if not, how can we best connect you? And then we at the YMCA do just different short little snippets of how can you reduce those numbers. And so when we're talking blood pressure, rinsing your cans. When we're talking blood sugar, you know, looking out for added sugar. But even what does it look like to work out at home, or what does it look like to connect you in our branch, so that we're really helping to reduce the number of folks who are experiencing chronic disease chronic disease diagnoses.
And breaking down that barrier of access is key in the ability to just inform and help people improve their health.
Exactly.
Thank you so much, Lisa, for joining us in the studio today.
Thank you so much.